Hi, everybody. Welcome to our second session of the for Tuesday of the 2021 Early Learner Forum. We had just heard from Linda Smith of the Bipartisan Policy Center talking about the business case for childcare. She gave us some astounding statistics and reasoning for the importance of this field. I would really encourage you guys to go back and view that recording if you weren't able to make it earlier today. It will be available on the website where you have been able to click and join all of these sessions. These sessions from yesterday are also all available on the website as well. My name again is Kayla Klein. I'm the director of Black Hills Reads Campaign, which is an education initiative under the United Way of the Black Hills umbrella. I am also the public policy chair for the statewide Early Learner South Dakota initiative and organizer of this event. Early Learner South Dakota's vision is that all children have access to high quality early learning experiences and environments to create a solid foundation for lifelong success. I would like to introduce our second speaker of the morning, Ben Horowitz. He analyzes and writes about public policies and programs at the Federal Reserve Bank of Minneapolis. His work focuses on affordable housing, early childhood development, and investments in low and moderate income communities. Prior to joining the Federal Reserve Bank, he worked in Minnesota's nonprofit sector and studied public policy at Princeton University. Welcome, Ben, and feel free to take it away.
Great, thanks, Kayla, and thanks so much for inviting me to participate in today's event. Before I get started, I need to do something that I often forget to do, which is to give a disclaimer that the views I present here today are my own and don't necessarily represent those of the Federal Reserve Bank of Minneapolis or the Board of Governors. For the record, they make everybody say that, not just me. So with that disclaimer out of the way, I'll go ahead and dive into the presentation I've put together today. I'm planning to talk a little bit about what the Federal Reserve Bank of Minneapolis does generally and how we started working on childcare and early childhood development more generally. And we'll be covering some of the ground that Linda talked about this morning with a little bit less detail in some cases and a little bit more in others. And we'll also talk a little bit about brain development. And I anticipate Gerard will go into a lot more detail than I get to there. But those are two really important pieces of how we at the Fed look at early childhood development as part of our work. Then I'm going to talk about some of the work we've done in South Dakota as we have started to look at how the childcare sector shows up in data in your state. So I'm hoping we can keep this presentation pretty conversational. Feel free to jump in with questions at any point in the chat, and I'll keep an eye on that. And as we get started here, I'd love for people, thank you to those who have introduced yourself. I'd love to hear what the first thing that comes to mind when you hear the words Federal Reserve is. Because the answer to that question always is interesting as I'm talking to different groups. So for those of you who haven't had a lot of experience working with the Federal Reserve Bank before, the Federal Reserve Bank of Minneapolis is one of 12 regional banks in the Federal Reserve System. Our district covers Montana, the two Dakotas, all of Minnesota, about 26 counties in Northwest Wisconsin, and the Upper Peninsula of Michigan. It's a really interesting shape. We have a map of it in our lobby, and a lot of times people think it's a really distorted view of the United States itself. We cover 12% of the nation's land mass, but only 3% of its population. So we're one of the 12 reserve banks that was set up in the Federal Reserve System to serve a few functions. First, we serve as a bank for banks, essentially. We provide a lot of services that keep our financial system up and running, including a lot of the infrastructure for how money moves around our society. And we play a role in monetary policy, which I think is what most people think of when they hear the Federal Reserve. They tend to think of interest rates. So all the Federal Reserve banks have staff that perform outreach work that put together documents for our bank presidents that help them understand how the economy is faring in their region. And that in turn filters into the national conversation around how monetary policy should be shaped. So you might be wondering where childcare enters the conversation so far. So about 20 years ago, the head of our Department of Research, Art Rolnick, was approached by leaders in our community here in Minneapolis who were wondering about the most efficient ways to invest public or philanthropic dollars in terms of a strict return on investment kind of mindset. So in addition to the other work I mentioned, the Fed employs more economists than just about any other institution in the world, and they love to dig into questions like this. It's funny to hear Art Rolnick talk about it now, as he's become one of, I think, the foremost speakers on the economic return on investment in early childhood education. But at the time, he was actually kind of skeptical that there would be a lot of great data on that front. But 15 years ago, he and a colleague of mine, Rob Grunwald, dug in, and their findings set us up for what is now going on almost 2 decades of work in this field. But before I go into more detail there, I'll talk a little bit more about the work my department does at the Fed. I'm in the Community Development and Engagement Department. We came out of the Community Reinvestment Act, which was passed during the Civil Rights era. It was an attempt to address redlining, which is a practice where banks were specifically excluding certain communities from access to credit, oftentimes based on their racial or ethnic composition. And so along with the creation of a new set of regulations that encouraged banks to end that practice, the Board of Governors created departments like ours to perform research and outreach to answer questions specifically about low and moderate income communities. So even though redlining often impacted communities of color, specifically our department works more generally, and the CRA deals more generally with questions about income. So back to early childhood development. So 15 years ago, Art Rolnick and Rob Grunwald started digging into this question of what does the world of research tell us about economic returns on investments in young children. First, they look to neuroscience, and I'm going to attempt my first screen share of the day. So let's see how this goes. All right. Not quite ready yet. Not quite ready for prime time. Okay. So, great. So there is a map of the Federal Reserve System. In case you missed my earlier description of the district we cover, we're up in District 9 there. On to the next slide. Okay, there we go. So this is an image of something related to early childhood development. I'm going to take another awkward 15-second pause to see if anybody can guess what it is in the chat. Great, we have some folks who might have seen a presentation like this before, or might be brain experts themselves. So these are images of the human brain, and specifically the connections that occur in the brain. So the little clusters you see that look kind of like roots, those are how our brain cells look at birth. Not quite a blank slate, but there's not a lot of connections between these different points in the brain. As children get older, connections form very rapidly over time until you see a network that looks like the one in the middle. But then what's really interesting is over time, those connections actually begin to pare away as our brain focuses on our earliest experiences and sort of adapts to what we've encountered over that time. So what we see here when we sort of map that process to how different competencies are developed among children is we learn that a lot of our most important skills are picked up in the first year of life. So that gray bar is the first 12 months of life, and then after that it shifts to years, and you can see that there's a rapid increase in how we pick up skills early on, kind of slows down over time as we do things like learn to share our screen on Zoom or pick up a second language during an advanced stage. So the neuroscience tells us that these early years are incredibly important. Next, Rob and Art started to look at what the economic research says about investments in children during these years when the brain is developing. They found that the research dovetailed really well with the neuroscience. So you might be wondering how you could analyze the costs and benefits of an early childhood intervention. Well, the cost side is pretty straightforward. You can think of all the money you spend on facilities, on staff, on training, on curriculum. The benefit side gets a little trickier. So what Rob and Art looked at were interventions that followed a randomized control trial model. And how that works is you start with a group of children, and you can think about trying to compare the children who receive a intervention to those who did not. And in order to make sure that comparison is as close to apples as possible, you use what's called a randomized control model. So that involves, you could think of, say, developing a program where you have 20 slots and you get 40 applicants, then you have 20 children who receive the benefit and 20 who don't. Over time, you can compare the children who receive the benefit to those who don't. And you can also ask a lot of questions to make sure that the children who were able to enter the program are as similar as possible to the children who didn't over time. So you're trying to get as close as you can to measuring what the program did versus what other aspects of their life might have done. And fortunately for the research in this topic, some people were thinking about this a long time ago, as long ago as 40 years in some cases. So Rob and Art focused on programs that had a long history of data and a solid method of measuring results. Those included the Abecedarian project, which took place in North Carolina, and the Perry Preschool project in Michigan. And over time, we've also looked a lot at programs like nurse home visiting and the Chicago Parent-Child Centers and Universal Pre-K in Tulsa. And when you look at these programs, some trends start to become clear. And the biggest one is that the public return on investment is pretty high. So they range from about $5 for every dollar invested when it comes to interventions around nurse home visiting to about $12 for every dollar invested in the Perry Preschool program. And the really interesting thing about those returns on investment is a lot of times people tend to think of the returns on investment as accruing to the children who participated in the program. So you can think about a child who received high quality early childhood programming going on later in life to earn higher incomes and benefiting in that way. But the crucial part of those returns on investment that I mentioned is that those are actually returns to the public at large. So I'm going to jump into screen sharing again here at great peril to myself here. Okay, great. So so this is a chart showing the effects of one of the programs I mentioned, the Perry Preschool program. So the blue bars are the children who received the intervention, and the yellowish orange bars are kids who applied but weren't able to receive the services due to the limitations of the program and the experimental design. So you can see that the kids in the program group were a lot more likely to achieve academically, to graduate from high school on time, and were also less likely to receive special education once they entered the K-12 system. So that's kind of the first order of results you might expect. Okay, if kids are in a high quality pre-K environment, then they're less likely to need help in school. They're less likely to struggle as they progress through the K-12 system. So we look at the next order of impact here, and you can look at some of the early results when it comes to kids' economic outcomes. So kids who went through the preschool program were more likely to wind up owning a home when they were a young adult. They're likely to have higher earnings, and they were more likely to have a savings account, which is a good intermediary for financial well-being later on. These are still relatively tied to the child themselves, but as we get further out, we can think about other things like criminal justice, which Linda mentioned this morning in some detail. And you see that children in the intervention group were about half as likely to have been arrested 5 or more times by the time they turn age 40. So once you go through all of these different impacts, then what you do as an economist is you try to tie these different outcomes to actual dollar amounts. So this is an attempt to do that. The top bar that goes to the left is the program cost, and everything that shows up on the right of that line is a benefit. And it's color-coded there so that the red amounts are benefits to the public, whereas the light green bar represents benefits to the individual who went through the program. So one way to think about this is under the participants earning bar, the third one down there, you can see that people who went through the program had higher earnings, which benefited them directly, but then the red portion of that is estimate of the higher tax revenues that come about as a result of that higher income. But outside of the earnings and the welfare payments, which go kind of in both directions, you can see that the majority of the return on investment really comes to the public. And that is also where some of the range of estimates that you might see when you look into this yourself, if you see there's kind of a range of estimates around peri or around abecedarian, it really comes down to how you calculate the value, say, of less crime or savings to the justice or education system. There's a number of different ways you can interpret that, but the theme remains the same. These programs tend to have a really high return on investment if they share some core characteristics, which I'll talk about in a second. So Rob and Art gathered a few examples of this. They ran some more complicated return on investment calculations. They compared it to returns on, say, investments in the stock market and found it outperformed those. And then writing for an audience that was in Minnesota, they compared the cost of creating a fund that would pay for high quality early childhood education for all the low income children in Minnesota, and compared that to the cost of building 2 new sports stadiums in our state. At the time, the Twins and the Vikings were both looking to upgrade their lodgings. So if you come to Minnesota today, you will find that we don't have 2 new sports stadiums. We actually have 3, the Vikings, the Twins, and our soccer stadium. And we don't have that fund for early childhood education, but the Fed did remain involved in a pretty direct way in Minnesota by helping to design and study a what eventually became an early learning scholarship program at the state level. So what were the common aspects of high quality early childhood education that were identified across studies when Rob and Art first looked at this that have remained true across time? One really important factor is that all the programs were really focused on parent involvement and engagement. So they weren't sort of just aimed at children, but also factored in parental participation. The return on investment also relies on targeting the resources to those who weren't going to receive them before. I'll talk a little bit more about the childcare market later, but Linda did a great job highlighting all the barriers that are out there as low-income families try to acquire high-quality childcare for their children. If you're thinking about a return on investment, you're really thinking about if public dollars are providing high-quality care to a child, would that child have received high-quality care otherwise? And so the more you're providing these programs to children who might not have access to them through private tuition payments, the higher your public return on investment is. Another key feature that has come up over the years is how well programs are integrated with the K-12 system. So if you are providing a lot of services to kids as they age into kindergarten, there's a lot of value in integrating those processes across systems. So kids are entering kindergarten with the skills that are going to be most helpful for them as they acclimate to that new environment. So those are three key aspects that we focus on in our work and in the content we create for our website. And as we try to bring whatever value we can to initiatives in our district to increase the supply of and access to high quality early childhood education. So I'm now going to move into a conversation that Linda really dove into with her comments around the market for childcare. And I'm going to lay out a framework for how we think about high quality early childhood education and the questions that we ask about the marketplace and that guide our research and our policy considerations that we tend to bring up. So in the childcare marketplace, we think of three main players. There's parents, and then there's childcare providers, and then there's the public. So when we're thinking about parents, the questions that we tend to ask are about how they decide to work or not to work. Parents don't necessarily need to be working to want or use early childhood education, but it certainly is a huge aspect of the decision for most people. In South Dakota, about 3/4 of the kids who are under 6 live in a home where all of their parents are in the workforce, which is a high rate nationally. Minnesota and South Dakota tend to swap out one of the top spots in this measure. And a lot of people, when I tell them about this stat, they want to know if that's because a lot of kids are in single parent homes. So if one parent is working, then all parents are working. But the number for 2-parent homes actually isn't that much lower. It's about 70% of kids who are in 2-parent homes, which is about 70% of all kids in South Dakota. So if you're thinking about whether parents are deciding to work or not work, in South Dakota, more often than not, the answer is yes, parents are working. And of course, for most people, that's not a decision in the traditional sense of the word, but economically speaking, they're making that choice to enter the labor force. Then we think about how parents would choose their provider. So there's a number of different ways parents could express their preferences for care. First, there's questions around culture. Does the child care provider share a value system with the parent that they feel comfortable with? Do they speak the same language? This gets to the point that I think Linda was raising around trust in providers. You can also think about how easily parents can access care. How close are they physically to their child care provider? And then something that comes up a lot because there is a lot of variation even across the states in our district is when parents are looking for care, what sort of information is out there on the market, and how can they gauge the quality of care that's out there, or even where providers are located. So a lot of states have systems that are set up to inform parents, including what's known as a quality rating improvement system. In a lot of states, that assigns a quality rating to different providers based on what's usually voluntary participation. The next level is to have some sort of licensing system that has a portal that parents can access to search for where licensed care is. And that's something that does exist in South Dakota. And these provide kind of a first order of access for parents. So as we were looking at South Dakota, one of our first questions was, if you were using kind of the most readily accessible information on childcare providers in South Dakota, what can you learn as a parent or as a researcher? So today, actually, we published a report on the state's early childhood development systems. And we included with that a map that I'm going to share here that looks at the supply of licensed or registered providers in the state relative to the number of young children who live in the state at a county level. So this is on our website, minneapolisfed.org. And I want to be clear, this is not the level of sophistication that the Bipartisan Policy Center's map looks at in other states, which takes into account other variables. There's also a childcare deserts map that is online, where you can look down at a community level. What this map is just looking at is, if you are a parent in one of these counties, how many spots are available in licensed or registered childcare providers relative to the number of kids who are under 6 in your community. So I'm not sure if you can see when I mouse over here, but in Jackson County, for example, there's 11 kids under age 6 for every spot of licensed childcare. So this wouldn't be a precise way to measure the childcare need in a particular community, but it does give you a sense of how, depending on where you live in South Dakota, the way that information is currently set up for parents, there's a pretty big difference in how you'll be able to find care. And I think one of the valuable things we bring from our research as the Minneapolis Fed is a perspective from rural communities that share a lot of qualities like this. And one of the things we hear a lot from employers is that a lack of easily accessible information on childcare really hits their ability to recruit new employees, because a lot of parents might find their care through word of mouth with folks who aren't licensed or registered. But if you don't know anybody in the area and you're moving there sort of sight unseen, then it can be scary to look at the licensing information and see, in a handful of counties in South Dakota, you may not even have an easy to identify childcare option. So we've talked about how parents choose based on their decision to work or not to work, about how they have different ways of thinking about their preferences for care. And the third bucket of questions that come about when we think about how parents might choose a provider is their income restraints. So again, Linda talked about this with a lot of great detail, but South Dakota is not unique in that the cost of childcare is fairly high relative to family incomes. So even though we know a lot of children are living in homes where all their parents are in the workforce, about a third of the kids who are under 6 in the state are also living in a home where they are living with incomes that are below 200% of the federal poverty line, which puts parents with limited options in terms of what they can afford to pay for in childcare. So moving on from parents to childcare providers, what are some of the important characteristics of childcare providers in South Dakota? I think in South Dakota, based on our investigation, the most unique aspect might be the lack of, or I shouldn't say lack, but the relatively high share of the market that is captured by unlicensed or unregistered providers. It's about a third of the market. Every state that I've looked at before goes to providers who aren't registered or licensed with the state, but South Dakota is one of only states that doesn't require in-home providers to register unless they want to. So a lot of times unlicensed or unregistered providers might be more small scale, but there are a lot of providers here in Minnesota, for example, who are required to register that wouldn't be required to register in South Dakota. So it's a really unique aspect of the state market. Some of the policy implications that come about because of that, I think during COVID, that were covered by Linda. One is that it makes it more difficult to communicate with providers when there are options for assistance or economic relief that are targeted to childcare providers if they're sort of not on your books. And some of the folks we talked to about this article raised the point that it would be difficult to distribute that aid if providers aren't aware that it's out there. You can't make them aware that they're out there if you don't have their contact information. Another way that it complicates some of the questions around the childcare supply are questions around what Linda identified as the shrinking number of family childcare providers. A big question in South Dakota might be how many of the childcare providers who are showing up as no longer licensed or registered, how many of those are actually retiring or closing, and how many might simply be dropping into an unregistered or unlicensed status. So that was one of the big questions we were left with as we looked at the state. So that's what we tend to think about when we think about childcare providers. Linda talked about it as thinking about the supply side of the equation. And we also think about it a lot. So now we've talked about parents and providers. Moving on to what role the state plays in the childcare market. And the questions we ask on that front, we look a lot at the childcare subsidies that are available through publicly funded resources for parents. And increasingly, as Linda pointed out, thinking about ways that public entities can also support the supply side of the equation. So the first role that states play in the market is to set that bar for health and safety that does come through licensing or registration. And connected to that are these questions around what information is available for parents. And when it comes to subsidies, the important questions that the public sector can ask are around the focus of the subsidy. Subsidies could be focused on a child, for example, by making eligibility contingent only on a child's family income and centering on providing as many children as possible access to high quality care. You can also focus subsidies around parental labor force participation. So the key difference between the two is that in a lot of programs that are funded by the Child Care Development Block Grant, if a parent loses their job or has to drop out of the workforce for another reason, then a child might lose access to that high quality early learning environment. When the Minneapolis Fed worked with policymakers here in Minnesota to design the early learning subsidies, we focused on the prior approach, prioritizing a child's access to a high quality learning environment over parents' fluctuations in income or ability to stay attached to the workforce. The other way to think about subsidies is who will be eligible. Income targeting is something that shows up a lot in the research as being really important for the level of return on investment in early childhood development programs. You can also think, as I said, about parents' activities. Are parents eligible if they're participating in the workforce, or do they need to be attending school, or are there going to be any requirements on parents beyond income? And then you can also think about what kind of care will be subsidized. So some states have incentives or even requirements around subsidies that children be participating in programs of a particular quality level. Final question around subsidies is around how the subsidies are funded. So in most states, funding is done based on an entitlement approach, or I'm sorry, an appropriation approach. So legislators set funding levels at a certain amount and families apply for subsidies. Once the subsidies run out, there's a waiting list or some other mechanism for keeping track of folks who applied but weren't able to access it. In other states, there are entitlements, which means anyone who is eligible applies and is able to access the program. Finally, states can perform a lot of really important research to inform all of these choices. So Linda mentioned one really interesting opportunity regarding the Child Care Development Block Grant. A lot of states set their reimbursement payments to providers based on market rate survey. And as she pointed out, states do have the option of pursuing a cost-based approach instead. But and a good reason to do that is what she covered in terms of the business model and childcare providers being really hard to keep afloat. That sort of gets wrapped into your funding levels if you're using a market-based survey as opposed to that cost-based approach, where a cost-based approach gives you a better sense of how much it costs for a child to receive early childhood education services in your market. In South Dakota, as we dug into the status of subsidy programs in the state, one of the big questions that we have after doing our first round of research is what the reason is for the gap between the number of children who are eligible to receive child care assistance as opposed to those who appear to be eligible. So there are a couple different reasons why a gap exists between eligibility and take-up. It could be that a lot of parents are living in areas where licensed or registered care simply isn't available, and licensing or registration is required for providers to receive those subsidy payments, for example. So I think Linda also did a really great job talking about how investments in childcare really matter to everybody across society, whether it's parents or providers or the public sector. And the sector that I haven't talked a lot about yet is the private sector. So when we think about philanthropy, lenders, or businesses, what roles are there for them to play? We've seen a lot in our district and across the nation, the important role that business leaders can play simply as leaders in this area. There's a lot of potential to work across sectors. We have a number of case studies on our website from Montana where, for example, an existing childcare provider was able to expand the supply of childcare in their region by leveraging their relationship with the local economic development authority, who helped them identify surplus space in an educational facility that could be renovated to serve more children. And then in order to make it more financially viable to expand, was able to connect the childcare provider with employers who wanted to be able to sort of reserve slots in the childcare center for their employees. So it helps take away some of the unpredictability in the business model, and also just brings in capacity that a very busy center operator might not have to pursue on their own. Philanthropists can play a really important role in funding local initiatives and maybe trying out new approaches that aren't yet allowable with public dollars, but can be wrapped in the future once the evidence base is there. And we also do a lot of work here at the Minneapolis Fed thinking about why the private sector should be paying attention to this issue. So we look at, we like to think of if we were making the pitch for early childhood education to Scrooge, what questions would he have? So I've talked a lot about the return on investment. On the flip side of that, we can also think about the opportunities that are lost because parents don't have access to high quality childcare. So nationally, there's been a lot of work recently to try and put a dollar figure to that amount. The estimate nationally is that about $13 billion are lost due to absenteeism and turnover by parents because of childcare challenges. We took that national methodology and worked with some partners in Montana to send out a survey to parents there to try to get an estimate of how much is lost to Montana's parents and businesses as a result of the struggles in the childcare marketplace there. And we found that parents are losing about $145 million in income every year, with businesses losing about $55 million in income a year, and government's losing about $32 million in revenues per year, all because parents are unable to work or take advantage of opportunities, or even have to leave their jobs because of childcare challenges. And the anecdotes we hear on this come in pretty regularly too that really stick out in my mind are an employer in a rural community that had a large manufacturing facility who said he was hesitant to ever hire anybody who worked in the childcare field because once he did, he knew he would get 4 or 5 employees calling off the next day because they had lost their childcare provider. Another is that we talked to someone who runs a large refining facility who talked about how hard it was, not just for him to employ people from outside the region, but for the healthcare system and for the public sector and for other large employers to recruit people for pretty lucrative positions because they were unable to connect people to childcare opportunities. So anecdotes like those are ones that keep us really engaged on the issue, because as we talk to more and more community leaders in our district, it's one of the top issues that we continue to hear about. We have now going on 20 years of experience in the field, and would just repeat Linda's offer from earlier today that we're always looking for ways that we can engage at any level to offer our research or convening capacities to folks who are looking to pursue these important opportunities for families. So that was a lot of information, and I didn't see any questions come in, so I finished. That's about all I've got.
No, you're good. I did actually have a couple questions coming in, some to me privately. I was curious. A lot of people were asking about the report that you mentioned. I just wanted to be sure that I got the right link in the chat. Was the report, I'm assuming it is because it looks like it was published January 25th, 2021. It's called Scanning the Early Childhood Development Landscape in South Dakota. Is that it?
Yep.
Perfect.
Yes.
Is the map you shared earlier on there as well?
Yes. So it's on there. You can hover your mouse over any county. And I'm happy to share the Excel data behind that as well for anybody who wants to see how we did that.
Okay. And then Ben, would you like to share your contact information with the group if they have any additional questions for you?
Sure,
I
I'm
do have a
dropping that
couple other questions,
yeah.
but yep, go ahead.
And I see
Perfect, thank you.
I see there's a question now about an ROI on healthcare and Medicaid costs among early childhood programs. One aspect of, so there's a few different ways of answering that question. So first, one particular program that people tend to think of in the healthcare arena that has been studied pretty extensively and shown ROI of about 5 to 1 are nurse home visits for families that might be at risk of negative outcomes for young children. So programs like the Nurse Family Partnership. Another way to think about that is in the more general early childhood education programs where they look at the long-term economic return on investment. If people are earning more wages as they age, then I'd have to go back and look at each of the individual studies, but I think some of the savings are tied to lower Medicaid enrollment. And oh yes, and thanks, ROI, return on investment. If there were any other pieces of alphabet soup that I dropped in there, let me know. But yeah, that would be my first response to the question on healthcare and ROI.
Great, thank you. So another question had come in was they were curious if you could expand a little bit more when you talked about the scholarship program in, I don't know if it was just Minneapolis or Minnesota. Expand a little bit more on that. Is that a full tuition portion based on a sliding scale or poverty level? Just a little bit more detail about that program.
Sure. So our child care assistance program in Minnesota looks pretty similar to the one in South Dakota. And I apologize. I looked at the participant list here and thought most people might kind of have a baseline understanding of that, but happy to talk more about how child care assistance programs tend to be structured. But as a lot of you are probably aware, oftentimes the reimbursement rate for early childhood programs in Minnesota tends not to cover the cost of providing care for children at a really high quality level. So what the early learning scholarship program does is it layers on top of our child care assistance program to close that gap. And there are also some pieces of the program that go to actually fund slots within child care centers that can then be also layered with other sources of funding to cover the costs of care. But the payments to providers on their own would not cover the full cost of care. The big distinction between it and the child care assistance program from a design point of view is that it doesn't really take into account parents' activities at all beyond just their income level. So whereas with child care assistance, parents get a case plan and are sort of monitored to make sure they're fulfilling certain obligations. In this case, it's just you get a scholarship, your child has a subsidy to attend high quality early childhood education for a year.
Okay, so my apologies. A quick clarification question. So for example, you're talking about the scholarships only going to child care assistance children, and using very simple math here, let's say they're charge from their center or wherever they're receiving care is $100. They get $50 from child care assistance. The scholarship program would cover the other 50. Is that kind of what that looks like?
Yeah. So sorry, that's what happens in some cases. In other cases, they might only be receiving the scholarship from the state, and there might be other funds that are filling in the rest of the gap. So it's so yes, the example you provided is what happens in some cases. In others, it's not the child care assistance program that's filling in the gap, but it might be other philanthropic or just the provider finding other ways to fill in that gap.
And where do the funds for the scholarship? I know you mentioned that there are some philanthropic entities, but the main source of it, is it coming from the state?
So I'd have to go back and talk to some people on our staff who were there 10 years ago to make sure I'm getting this exactly right. But I believe the first pilot was philanthropy. And then once there was a bit of a track record of success, the state then invested from the general fund to pay for the scholarships. So like child care assistance in Minnesota, it is an appropriation. So it doesn't serve all of the eligible families for the scholarship. And I should have gone back and looked at these numbers before this presentation because folks are always really interested in it. But there's a significant shortfall in terms of reaching all eligible families. But yeah, so it's funded through our state's general fund.
Good to know. Okay. Well, we might be getting back to you on that with Early Learner South Dakota work because that is very interesting.
Yeah, and I should say that going back to what I was saying in terms of the role the Fed can play in different initiatives, that was the pilot was really bringing together people from early childhood education with people in the world of finance or business to bring all of those capacities together to think about what the best intervention to fit in Minnesota's context would be. And there's some really inspiring stories from that. For example, there was a neighborhood in St. Paul that didn't have much of a supply at all of high quality early childhood education. And because of the work of that sort of initial committee, they were able to bring on board a child care operator to open up in that facility, basically to serve the children who were going to receive these early learning scholarships. So it was an interesting way to bring together different capacities from different sectors in our specific context to think about what Minnesota families could really benefit from.
I feel bad I'm asking all the questions, so this is really interesting. So knowing that for Federal Reserve Bank of Minneapolis, we are within the region, is that something then the Federal Reserve could potentially help South Dakota with? Oh, you went on mute somehow. Sorry about that.
Yes would be the short answer. So we are always happy to hear about ways that we can bring our expertise and resources to assist in communities around these issues. So I should say, when people hear Federal Reserve Bank, they tend to think of us as being able to bring financial resources to things. That's not a role we can play, but I think in addition to being able to present on the research and speak to what we know from our work engaging across the country on this area, we also can bring relationships sometimes with people who might not be at the front of mind when you're thinking about early childhood education, like lenders who might want to play a role in their community but might not know how to do so. So the short answer is yes, but of course, like all organizations, there's always constraints on our time and whatnot, but would love to hear about any ways that we could continue to be active in the state.
Perfect. Well, I'm sure you'll be hearing from one of us. So last question that I have so far, and folks, please feel free to ask any additional questions, but I'm going to bring one of the questions back to your original piece when you were talking about how Art and Rob did some digging, and they specifically used the Perry Preschool Project and Absidarian report. Why did they choose those two reports versus, let's say, Head Start?
That's a great question. So The Abecedarian and Prairie Preschool projects are kind of a gold standard of research, which is very expensive to produce. That's one reason why there's not as many examples out there that are a gold standard, and the other is simply time. So both took place long enough ago that you can see the carry through from children's earliest years into adulthood. And now in some cases, we're actually seeing how the impact of early childhood education carries through across the third generation. So we know parents in these programs did a little better, which is not something we talk about as much or as often. We know the children who go through the programs do better. And now we're seeing that the children of the children who are in these early childhood education programs are also doing better. So that's why those two at the time were there. Since then, there's a model in Chicago, the Child Parent Center, that has shown similar returns and is now, I believe the first birth cohort they looked at was from 1980. So they're now adults. So we can think about what we can draw from the data there. And there's also some looks at some of the earlier universal pre-K efforts like in Tulsa, Oklahoma. So there's some references to those in the state or in the report with links to the research. And you're mentioning Head Start. Maybe you realize I forgot to mention one really important narrative that does come up when you talk about early childhood education research. A lot of people are aware of especially with Head Start, some research that people tend to talk about as demonstrating a fade out effect, or the concept that over time, the gains you see in young kids might go away. It's really important to note that the really high ROI pieces of research really take a long time to see in the data, just because it takes a long time for a 3-year-old to become a 30-year-old, about 27 years, I think, if my math is right there. So that's one piece of it. And also a lot of the studies that show a fade out in the context of Head Start, for example, aren't really focused on specific programs. So Head Start has a lot of great programs. It has a lot of programs that are half-day programs as opposed to full-day programs. It has programs that use some really proven curriculum, some that are a little bit less rigorous. So when you're looking at a really big program like Head Start, it's important to note what questions you're actually asking. And I think a lot of the research that tends to be put into the sort of fade out argument doesn't distinguish, first of all, between those cognitive gains, which are really important to track, and those long-term economic benefits, and also doesn't always disaggregate between different types of programs. So you're not really doing the same kind of level of analysis as you are when you're looking at a particular program with not just the program, but also a really good set of kids who, like I talked about when I was talking about randomized control trials, you need not just the kids who were able to participate in the program, but you need the kids who are like those kids in as many ways as possible, except they didn't get access to the program. So that was a very long answer to a pretty simple question, but that's why. And fortunately, in the 15, 16 years since that report came out, there's just been more and more validation of the concepts.
No, I really like to ask that question just because the fade out is brought up quite often, saying, trying to falsify those two particular studies that you referenced. So it's nice to know that they do reach a gold standard, meaning I would assume methodology and just kind of the way they're conducting their research and those types of things.
Yeah, and that's not to say that the Head Start studies aren't important in their own right. And I think it gets to why it is so important to work with local stakeholders to understand what intervention you're designing to target what outcomes. So So if you're trying to measure the results of a high quality early childhood education program that also incorporates parent engagement and is integrated with a K-12 system, that's a very particular intervention, as opposed to what we've heard over the course of today, a lot of other really important ideas like supporting wages in the childcare sector, or something that I thought about earlier too when Linda was talking, supporting family childcare providers to give them access to resources to stay open and also understand themselves as business owners and have access to things like more affordable lines of credit and things like that. So it's not to say that you need to roll out an abecedarian in your area and that's the only sort of option you can justify based on the research, but it is important to understand all the different things that are in play in your community.
Right. Well, thank you so much. I appreciate it. Now we are up to time. I just want to thank Ben so much for his time here. I didn't see any other questions coming in through the chat. Just as a reminder to everybody that we do have our third and final panel today, starting at 1:30 Mountain, 2:30 Central Time, the science of infancy and early childhood. You can find that on the website as well. Ben, did you have anything else to say, just a closing statement?
No, I would just reiterate, my information's in the chat, and would love to hear people's thoughts on the reports, what questions it left them with, or what questions we might be able to answer as a follow-up. And yeah, if there is a role you have in mind for the Fed potentially contributing in your area, don't hesitate to reach out, and would love to be in conversation.
Wonderful. Thank you so much. And if you'd like more information on Early Learner South Dakota, you're welcome to visit our website, or I did put my email in the chat as well. So again, we're going to take another about 45-minute break, and we will see you at 1:30 for our final session today. Thank you again, Ben. I really appreciate your time. Thanks for everyone for being here.